Cirrhosis is end-stage disease characterized by irreversible diffuse fibrosis with formation of regenerative nodules. Now, in cirrhosis, what happens? There are certain signs like jaundice, variceal hemorrhage, ascites, encephalopathy, along with portal hypertension. So these are specific findings in cirrhosis. Causes of cirrhosis are viral hepatitis B, C, alcoholic liver disease, primary biliary cirrhosis, primary sclerosing cholangitis, autoimmune hepatitis, hemochromatosis, Wilson disease, alpha 1 antitrypsin deficiency, and cryptogenic cirrhosis. These all are causes of cirrhosis. Now, the clinical presentations of cirrhosis are first of all, patients become asymptomatic, then he develops anorexia and weight loss with jaundice, coagulopathy, and encephalopathy, portal hypertension, then that converts into ascites, esophageal varices, and the signs are liver. In liver, there is enlargement of the liver, shrunken and nodularity of the liver occurs, and uncompensated cirrhosis, there is xanthelasma, spider angiomata, enlargement of the parotid gland, gynecomastia, splenomegaly, liver is enlarged, purpura, and pigmented ulcer along with clubbing in cirrhosis. Signs of decompensated cirrhosis are encephalopathy, asterixis, ascites, edema, and feta hepaticus. Signs of portal hypertension are splenomegaly, ascites, caput medusae, esophageal varices, and investigation for cirrhosis will be liver function test like serum albumin, PT, INR should be maintained, LFT shows elevated bilirubin, elevated AST, ALT, serum ALP will be elevated. In electrolyte assessment, there will be hyponatremia and elevated concentration, and CBC shows anemia, leukopenia, thrombocytopenia. Causes of uh, these causes related investigations will be in viral hepatitis, hepatitis B, C viral markers should be performed, serum autoantibodies should be performed in autoimmune hepatitis, and serum immunoglobulin, iron profile, copper, ceruloplasmin level, and alpha 1 antitrypsin deficiency should be looked. So, imaging testing will be abdominal ultrasound, CT scan, endoscopy, MRI, and liver biopsy in order to confirm the cirrhosis and nodularity of the liver. So, in this way, cirrhosis is diagnosed by laboratory. Now, complications of cirrhosis can be ascites, and in ascites there is accumulation of the fluid in peritoneal cavity more than 500 milliliter, then portal hypertension, progressive heart failure, hepatorenal syndrome, hepatopulmonary syndrome, spontaneous bacterial peritonitis, and hepatocellular carcinoma. Now, the complications of cirrhosis will be portal hypertension, and in portal hypertension, there is pressure greater than 5 to 8 millimeter of mercury, and complications of the portal hypertension will be when pressure in the in the venous pressure, portal vein is greater than 12 millimeter of the mercury, that is known as portal hypertension. So these are the complications. Clinical features are splenomegaly, ascites, feta hepaticus, and Brugmann-Brugharten syndrome. Then the patient develops ascites, means when peritoneal fluid is greater than 500 milliliter, and because of hypoalbuminemia, ascites develops, abdomen becomes distended, fluid thrill and shifting dullness will be positive, and management will be water and sodium restriction, and giving spironolactone in order to decrease the ascitic fluid, furosemide, diuretics, and treatment of refractory ascites is first line treatment for refractory ascites is large volume paracentesis. So in this way, ascites is treated.